Discover Specific Chiropractic in Hilton Head with Luke, a patient of Dr. Ken. Good to see you again, Dr. Ken, and nice to meet you, Luke.
Nice to be met.
We're talking about neuropathy and exactly, what it is and how it affects different people, differently. So I'm going to start with you, Dr. Ken. Well, really, what causes neuropathy?
It could be various things. Sometimes it's hereditary. Sometimes it's a lot of multiple traumas to the feet. Sometimes it could be side effects to cancer treatments. It just varies from patient to patient. And
some patients aren't as disciplined and as compliant as this one.
Yes, that's right.
So tell us a little bit about what was going on with you, Luke.
Well, my feet were, number one, always cold, which didn't go well at home. Being told to put socks on in July.
Right.
But feet were cold and they would tingle. And you can't stop it. It's just like it's something crawling around in there. And so it bothered me quite a bit. And numbness, I didn't have any balance problem. Somebody said, well, you can't stand.
Right.
I didn't have that problem, fortunately. So my wife come in to see Dr. Ken, and she come back and said, there was a poster down there, how to help with neuropathy. So we come down, met everybody here, and went through the whole first round. And said, okay, we'll do it.
Were you doubtful at all in the beginning? Because a lot of folks are, Dr. Ken says.
No, it's all the people here were so professional, so nice. Nobody just, well, whatever, sit down. Right. So it was very enjoyable. And he said it'll be about 20 weeks.
Yep.
Twice a day. Well, we can do that.
So you come in and see Dr. Ken like once a week?
Once a week.
But you have to be very disciplined at home. You do a morning treatment and with some equipment, and then also at night.
Correct. And have the equipment there, and I just get up in the morning, read the paper, do the first part.
Right.
And the morning one takes probably 45 minutes. Evening takes a little longer because you have some more equipment, vibration things and all that. But fortunately, just the two of us living there. We don't have any pets to walk, but we're out walking and doing stuff, golfing. Not well, but golfing. So I'm just very happy because all of a sudden my feet aren't cold, my hands aren't cold.
Let me feel your hand.
Yeah.
It's warm.
Yeah. See, right?
yes, it's warm, normal.
They showed me pictures that they were blue.
And you had no idea that your extremities were blue.
Well, I grew up in Wisconsin. It's so old. But no, I had no idea it was that bad. You go looking and going, but the last pictures, everything was better.
Yeah.
So how about balance? Were you okay with your balance? It was just mostly the tingling and the coldness.
Yeah, just the balance wasn't really a problem that I know of.
So Dr. Ken, if he had not had treatment, would it have gotten worse?
Most of the time, yes. So most of the time it's just, for some people, it's very, very slow. Okay. So for like Andrea, it was like 7 years.
Right.
Others, they come in, they said they had it for 23 years. And then others said they didn't feel anything till the last 6 months or year. So everybody is different.
And when you first see a patient, the assessment takes like an hour or so?
Yeah, it takes a while. So it takes a while. You got to get a good history, and then you got to do a very thorough exam. So if patients are too advanced, we can't take them on.
Right.
So some people are so advanced that we can't reverse it, and then there are others that we can easily reverse. So we make sure we tell them that can be done. Yeah.
And you have success stories.
Yeah,
like
it's exciting.
Luke.
It's very exciting.
Really happy with it all because everybody goes, I've heard it's horrible. Well, twice a day I'll do that to make sure it doesn't get any worse.
Right.
Yeah.
And you enjoy your walks. You said early in the morning you enjoy, and so to be able to continue to walk like you do, and
about 2.5 to 3 miles a day.
That's awesome.
It's all about quality of life.
And play golf.
And play golf.
It's good. It's a good
Not
thing.
well, but
I still have the same amount of clubs I started with.
Oh, it's so nice to meet you. I'm so glad you're doing well.
Yeah, I feel good.
Great.
I'm happy, and
yes.
all the remodeling's about done. So
he's done a lot of home.
I know. He and his wife do it themselves.
Yeah,
he said.
it's amazing.
He was an architect all his life, 50 years.
Yeah, 50 years of over a big old wooden drawing board.
Well, congratulations
Well,
to
thank you
both
very
of
much.
you.
Thank you. Thank you.